Mr. Chairman, thank you so much. Before I begin, I wanted to submit for the record a statement from Egan Kemp, who's the healthcare policy advocate for Public Citizen, which makes the important point that even Americans who have insurance today are facing spiraling costs, and that a Medicare for All system will enable us to lower prices and restrain the extraordinary growth in drug prices we've been seeing. I also want to recognize the presence today of the president of National Nurses United, Jean Ross, who is the leader of an organization that has been heroically fighting for health care for all Americans for many decades, and I just wanted to recognize her. Mr. Chairman, thank you for calling this historic hearing, which is a breakthrough in the national dialogue about health care and what we're going to do to deliver health care to all of our people. I think not since Senator Kennedy had a hearing several decades ago about health care have we had one that is this comprehensive, this detailed, and this serious, and I want to thank colleagues on both sides of the aisle for participating. I especially want to thank you, Mr. Barkin, for your very lucid and poignant and compelling testimony today. And I wanted to start by saying that 9 years ago, I sat where you sit, metaphorically speaking. I was suffering from reflux symptoms and went to the doctor who recommended that I go in for an endoscopy, and they said, while we're at it, why don't we have a colonoscopy? We wouldn't normally do it this early. I think I was 47 at the time. But let's just go ahead and do it. And when I woke up, they said, well, we've got good news and bad news. The endoscopy went fine, but we found something in the colonoscopy, and I had stage 3 colon cancer and was off to the races. And I did it all. I did radiation, I did chemotherapy, I had surgery twice, and I can't imagine any of my fellow citizens going through such a trauma, something of such an enormous emotional, psychological, and family strain as that, and not know where they're going to get insurance. Now, I was a state senator, and I was covered by Maryland's health insurance plan. Most state legislators don't make very much money. I think we were getting paid $40,000, $45,000, but we had a great health insurance plan, and I was covered, and I was able to deal with it. But it opened my eyes to the fact that this is a crisis in our country, that there are tens of millions of people who don't know what they would do in the event that they came down with a diagnosis like that. Like Mr. Barkin, I decided that I was going to try to go through this personal crisis by staying at work and by engaging with the things that I loved. And one of the things I was working on was I was leading the floor fight in Maryland for marriage equality. And we adopted marriage equality. We became the first state in the union to do so without a judicial order compelling us to do so. Mr. Chairman, all glory to Massachusetts in all cases, but Massachusetts did have that judicial order from the Supreme Judicial Court telling them they had to do it. In Maryland, we didn't have that, but we passed it anyway. And, as the floor leader, you've got the opportunity when it's all over to make a little speech. And I got up to thank my colleagues because I had been wearing a chemo belt to the debates and to session for several weeks. The guy who sat next to me, Jim Brochin, who's a great conservative Democratic state senator from Baltimore County, said that I just wore the chemo belt to try to get sympathy and votes for marriage equality, which is probably right. But we ended up pulling him over and changing his mind about it, so it worked, I guess. But I got up and I said, that I had learned something in this process about the difference between misfortune and injustice. As if your life is going great, you've got not one but 2 jobs that you love, and a wife that you love, and my wife is here today, and kids that you love, and constituents you love, and you go to the doctor, and the doctor tells you you got stage 3 cancer, and you got a 50-50 chance of coming through it alive. That's a misfortune. It's a terrible misfortune, but it's just a misfortune because it's built into the nature of our species, Any of us could be assigned such a verdict on any particular day. Anybody could get such a diagnosis. But if you experience such a misfortune and you get such a diagnosis and you can't get health care because you love the wrong person, or you lost your job, or you're not working, or you're too poor, that's not a misfortune. That's an injustice, because we can do something about that. And life is hard enough, Mr. Chairman, with all of the illness and accident and heartbreak, for government to be compounding the misfortunes of life with the injustice of denying people access to health care when they get sick. And in the richest country in the history of our species, at its richest moment, not to advance forward to adopt a Medicare for all system is to deny, I think, the common humanity of our fellow citizens. And I read an essay during that period by Susan Sontag, who said that everybody's born with two passports, and one passport is to the land of the healthy and the living, and the other is to the passport of the sick and the dying. And we all hope that we're just going to use one of our passports in life, but in truth, all of us are going to use both of those passports. And to me, it is an elementary question of democratic solidarity and equality, whether we are willing to acknowledge that all of us are going to use those passports, and we should make everybody's trip as easy as possible. So I'm a co-sponsor of this legislation. I'm not going to hide that fact. I'm not just a neutral, objective questioner here. But I am fascinated about how we're going to get through this process and bring everybody aboard and come up with a system that makes sense to all Americans. Now, I want to ask a question that came up before. I think Mr. Barkin raised it, about how we ended up tying in our society healthcare to people's employment. I read something, and I don't know whether it's true, but I read something which suggested that it goes back to World War II, when there were wage and price controls, and employers, in order to attract new talent, had to give them something better than higher wages, and they offered them health insurance. And that began quite accidentally, quite arbitrarily, the connection of employment and healthcare. And I just wonder if anybody could illuminate that for me. Perhaps